I think, again, the level of addiction that we're seeing is really unprecedented in, in terms of the trajectory of use from initiation to dependence. And for example, I had a student I was working with a few months ago who had started vaping just 4 months previously. He was a first year, and was already getting as much nicotine as someone who smoked a pack a day of combustible cigarettes. When you start using nicotine products under the age of 26, nicotine actually rewires your brain to predispose you to addiction for the rest of your life to nicotine. I think that news has hit people pretty hard, and I'm seeing a couple of different responses from young adults. One is to seek help in quitting, which is fantastic, and we are excited to be able to support folks on that journey. The other is young adults deciding that, well, these e-cigarettes are too dangerous, so I'm going to go back to smoking combustible cigarettes, which is incredibly unfortunate. And so treating nicotine addiction is treating nicotine addiction regardless of the form. And we'll, in the next 5 or 10 years, we'll know more about sort of the nuances there. But there's a pretty clear path in how to treat nicotine addiction, kind of generally speaking. The addiction to nicotine, which can be treated by replacing the missing nicotine with nicotine replacement therapy, like the patch or the lozenge or the gum. The best practice is to use more than one. So using both the patch and the gum, for example. A big part of quitting any kind of tobacco product, nicotine-containing product, is addressing the function that product is playing in your life, and creating an environment that's supportive of the quitting journey. It is hard. It's work, and it might be uncomfortable, but it's worth doing. And so just because it's hard, that should not be a reason not to do it. And I want to again emphasize that there is support out there for people who want to quit, and you will be more successful in quitting if you take advantage of the support that's available to you. When I see these young adults come into my office sort of desperate to quit using whatever products they've been using, I'm really reminded of myself and my friends when I was at their age. I began smoking combustible cigarettes in the 90s at the age of 12 and was immensely addicted. And I think about sort of tobacco control and public health and all of the work that we've done over many, many years to try to prevent young people from starting to smoke cigarettes so they don't have to go through this painful withdrawal, quitting process. And a lot of that has now been undone.